First tonight, Governor Raimondo says phase 1 of Rhode Island's reopening is going well so far. I'm Shannon Heggie.
And I'm Mike Montecalvo. However, she's warning the state is feeling the pinch financially, which could mean tough news for state workers. Today, the Rhode Island Department of Health reported another 14 people with COVID-19 have died. The state's death toll now is at 444. Number of people in the hospital about the same as yesterday. Governor Raimondo says overall the state's numbers are steady.
The governor also is urging people today not to fight against new regulations, but instead accept what will be a new way of living for the foreseeable future. Eyewitness News reporter Kim Kalunian joins us live from Providence. Kim?
Well, Shannon and Mike, that's right. The governor says today she is pleased with how things have been going since the stay-at-home order was lifted here in Rhode Island this weekend. And now, after weeks of telling people to stay inside, she is asking people to safely get back out there.
What we are doing now is going to show up in our cases 2 weeks from now.
Governor Raimondo asking Rhode Islanders to be mindful of social distancing and face covering guidelines as the state takes its first steps to reopen.
It's time to be brave. It is time to start coming out again, slowly, carefully, with the new rules. So my birthday's Sunday. I told my family, take me out for dinner next week. Like, I plan to go out.
On Tuesday, Dr. Nicole Alexander Scott offering some clarity to diners who will now be asked to leave their contact information with restaurants.
You would not be asked to quarantine unless you were a direct contact of someone who tests positive for COVID-19, which is unlikely to happen in a restaurant setting unless it's someone that you are directly at a table with.
Restaurants will be allowed to open outdoor dining areas with restrictions later this month. The governor says she knows the plans are not ideal for everyone.
The choice isn't in-room dining or outdoor dining. The choice is outdoor dining or nothing.
The governor has said repeatedly her focus is getting people back to work safely. And while she doesn't want to contribute to the unemployment rate by furloughing state workers,
with an $800 million deficit, it is hard to see how we get out of this without doing furloughs.
On a brighter note, the governor says the state is doling out $8.2 million in hazard pay to more than 10,000 workers at more than 160 congregate care facilities.
This is not perfect in any way. As I've said from the beginning, no program we're rolling out is perfect, but it was an attempt to help stabilize that workforce.
And again, at this point, hospitalizations and the 7-day average of new cases are both trending downward. On Thursday, the governor says she will tell us which metrics the state will be looking at to determine whether we have to move backwards or whether we can move forward into phase 2. Live at the State House, I'm Kim Kalunian, Eyewitness News.
First at 5:30, Governor Raimondo says she's pleased with how phase 1 of Rhode Island's reopening is going so far.
While she says people must continue following social distancing measures and wear masks in public, she is encouraging people to, quote, start coming out again, especially people who need medical care that's not related to the coronavirus.
Eyewitness News reporter Kim Kalunian joins us live from Providence. Kim?
Shannon and Mike, another part of reopening the economy, hospitals and medical centers are once again offering non-emergency surgeries and other medical procedures. Today, the governor says if you need to have one of those, you should now get it back on your calendar.
A lot of Rhode Islanders have been delaying on the health care that they feel they need, delaying on going to see their doctor, going to get that test, going to get that immunization. We've heard from the hospitals this week, hospitals are back up and running for non-critical surgery procedures and appointments. Here's what I want you to know if you're a Rhode Islander who has delayed a procedure or a test or a surgery. It's safe to go back. We're hearing from hospitals and large physician practices that patients are still afraid. The doctors are there, the hospitals are ready. They're doing more testing, more cleaning, more social distancing, more quarantining, more infection control, but patients are still afraid. So today, I want to say to the Rhode Islanders who are out there, I want you to have confidence. We wouldn't be allowing this if it weren't safe. These hospitals know what they're doing, they're safe, they are open for business, they're taking it slowly, they are ready to serve you. And if anything, if you've been delaying your health care for the past couple of months, it is time for you to muster the courage to go ahead and schedule that appointment. So if you get a call from a hospital, if it's time to reschedule an appointment or a surgery or a test, go ahead and do it. Go ahead and do it. I know you're anxious. I know you're anxious, but in this stage 1, we're going to walk before we run. We're taking it slowly. They are ready. They are safe. And I'm encouraging you to go ahead and get that health care that you've put off for the past 8 weeks.